Hey guys, Don here. Welcome to Podiatry Practice Mastery, and we're trying to help you get your practice to the $1 million mark and beyond. We're going to do a short little podcast today about this kind of new thing. So kind of the backstory here. In our practice, we have been using foam rolling for a long time. If you listen to anything, every single plantar fasciitis patient, every single Achilles patient, they're getting foam rollers, and they're tending to get ultrasound, and then they're going to PT and things like that and doing shockwave. But one way is you want to always look at ways that you can kind of increase the per visit value. And kind of here's a good option here. We're having someone here in my office here, and we're going to talk and do a little interview about a new product that has like an ankle brace. It's called Alleviate, right? There's an ankle brace. There is a kind of like a self-graston tool, and it comes in a little kit that you guys can offer in your practice. So I'm going to interview them, and they're going to tell me a little bit about it. Welcome.
Hi, Dr. Pelto. Thanks so much for having us. I'm Virginia Chan. I'm the CEO of Alleviate. We're so excited to be here with you.
So tell me a little bit about how this has affected. What I think that listeners really like is you were just at a practice, and tell us some practice experiences. Like they had a little heel pain clinic, or you visited a practice, and how they use this in their practice.
Yeah, we visited a clinic in Florida, and they started a heel pain clinic for their patients. So their patients came. They had about 11 attendees. They talked about the typical causes for plantar fasciitis, typical courses of treatment that they offer within their clinic. It was a great ramp up to understanding custom orthotics and 3D printing that they do in their clinic. And myself and my partner were there presenting Alleviate products as well. We were able to sell some of our massage products, our compression socks, and our braces as well. So overall, it was a great option for the clinic to inform their patients on options, treatment, root causes, and really well attended.
You know, I've talked a while about doing basically a monthly event. So you want to do monthly events, things that really bring in profit. So for our practice, the biggest profit makers are musculoskeletal. So it'll be like shockwave patients, plantar fasciitis, Achilles tendon. And doing these monthly events, I think, are a great idea. I kind of fell off the wagon. To do these, it takes a little bit of, advertising, have people come in, things like that. But every day in our office, we offer foam rollers. So what this is probably going to be for me is a substitute to my foam roller. So every patient that's getting a foam roller or getting your stretch routine that you give them for plantar fasciitis, you can do this. And the biggest takeaway for me was it's like a package, and it looks cool, kind of has an apple look to it. And it really hurts in the back of the calf. So I did it on the foot, but it can replace my foam roller. So now patients, when they come in and for visit one, we could talk to them, hey, you have the option. You can do foam roller, or you can do this kit. This kit's going to be better for you. That's kind of the thought I have. And it has a nice price point for doctors, so it's like a 100% markup. So you buy it and you offer it to patients. And I think it's going to be something pretty easy for patients to use in their practice, or in your practice, for the patients to get it. And so they do sell it online. So if you want to go to their website and check it out, is it alleviate.com? Is that how can they learn more?
Yeah, you can learn more by visiting alleviatetherapy.com. The product is called the Arch Massager. It's based on graston or I-stem technique, where people can self-manipulate and self-massage tissue. So great for plantar fasciitis, great for heel pain. You can also release tight calves. And in general, it's an awesome tool to add to increase that visit value for you. So as Dr. Pelto said, really, really important tool, not just for patients to self-manipulate and self-massage tissue, but also a great way for you to increase your revenue.
Yeah, and so my thought is, like right now, my patients are getting 3 sessions of shockwave, and then they're coming back 6 weeks after they do PT. So I'm always thinking of is there a way I can simplify their experience and cut out some PT? I talked about this recently. Like, I love sending them to PT. I'm a big believer in PT. Like, I love my PT people. But that's like 6 weeks and 12 visits. And so if they can do more home therapy, maybe for a select portion of them, it might save them time. So if you think about the copays going to PT, and now they will just get this kit. And so right now, the numbers look like this. So personally, everyone's getting foam roller, which is $35. This kit is $215, so it's a little bit more expensive. But let's say they're doing 3 sessions of shockwave. So 3 sessions are $750. You tag on another $215, and so instead of $750, it'll be about $1,000, which is a pretty easy. You can just package everything together. That's kind of the thought in terms of the economics. So I'm going to talk to the inventor right here now. Welcome.
Thank you very much. My name's Luke Ferdinands. I'm the inventor of the Alleviate products. I'm a physical therapist and been a physical therapist for 20 years. So when you are sending your people to PT, obviously you're wanting some work to be done on the tissue, the posterior chain through the calf into the soleus. and foam rolling is an adjunct that you can use for that sometimes. A lot of physical therapy is trending away from that, where they're simply just doing exercise now, so people are not getting worked in and on the tissue when they go to physical therapy. So you can use the massager that you're probably looking at online to not only work through the heel, the tight arch for tibialis posterior, Achilles, arch dysfunction or plantar fasciitis. You can also work into that posterior chain and use it as a trigger point release to go through the gastroc and through the soleus as well. And so that's a little bit more effective than foam rolling, because foam rolling rolls with the tissue, and this you can place on that trigger point of the medial head of the gastroc and just plantar flex and dorsiflex. And when you were talking before, really interestingly, about those heel clinics, great way to get people who are really incentivized, who are motivated to come in and learn about the pathology. Not only that, but a great way that you can show them your product suite, help them as well, but we can also provide a ton of information to you in regards to your heel pain patients. We actually had a paper that was written about our products and the efficacy, so you can really sell them to your patients and make sure that they are informed about the quality of product that they're getting.
Now, I just have a quick question. So PT, I use it a lot, but a lot of times what I tell them is, well, they're really going to look at your core strength. They're going to look at your hip mobilization. You know that more than I know that. Is there a certain subset I'm going to still send a PT? Like, let's say I switch this around. What about the hip, the core, the other things that they're looking at if they're good PTs?
So a good physical therapist will address both downstream and upstream causes, clearing the joint above and clearing the joint below, obviously. And so what we do is we have an exercise program that people can work with, and it looks to strengthen the intrinsic muscles of the foot. We start there, we move to the ankle, and then we encompass exercises for the knee and for the hip as well. And people can use this to check in along the way and start with their VAS of pain scores and log where their pain is, and then they can track themselves over the course of that.
So there's an app, right?
Yeah, and you can see where they are as well in terms of the progression of their pain and adherence to exercise. You
know, it's an interesting thing. I'm just, because I'm an idea guy, if you could incorporate this into something called remote patient monitoring. There's another company I'm working with that has it's called Next Step, and so I give exercises for my plantar fasciitis patients. They're doing like foam rolling and morning stretch. That's tracked, and then we can bill insurance $60 a month if they track more than so many days. So I'm just throwing out ideas. If you could somehow incorporate that, or get this other company to incorporate with you, then you could this be a billable service for doing remote patient monitoring with your app.
Yeah, definitely something that we've been considering and thinking about ways that we can increase patient value, visit value for you. It's huge. And then the added, not only the benefit of insurance billing, but also just the benefit of seeing how your patient is progressing over time. One of the common complaints we hear from podiatrists is that patients, when they find something that works for them, go away and you don't really get to see how they progress. But with remote patient monitoring, you can check in with them. You can also potentially get more visits from them because you know whether or not they're progressing at the pace that you expect. So there's huge benefit from a billing standpoint, but also from a patient outcome standpoint.
That's cool. So I'm looking at the little box here. It's kind of a cool box. It has these almost like an ankle brace that has a stirrup that pulls up the arch of the foot. I'm making it really simple. You watch the website, that'll explain a lot more. It has compression socks and like a balm, which almost like something you would massage over the top, and then it has the actual this space age tool type of thing that uses for the graston for the bottom of the foot. So that thought is, you have it in your treatment room, you're talking to the patient, you say, hey, why don't you put your foot down on here and do that for a few minutes and then have them walk after. We used to do something very similar for the back of the calf. They foam roll in the back of the calf or do the trigger point tools, which is a different, deeper massage tool. And then when they walk, a lot of times their pain is better. So there's something called, within sales, chiropractors use it. It's called a dynamic demonstration. All it means is they come in pain, you have them do something, and then they're in less pain. So they believe you. So they're more bought in for that. So this is where you could use something like this.
Yeah, so we just simply test, intervention, retest, and I'll either get people to do a heel stand, a heel walk, use the tool for 2 to 3 minutes, and then perform that same test, and they notice that their pain decreases. We don't need to sell our product at that stage because the product has created credibility, it's reduced their pain discomfort, and it's an easy sell for you. It also increases your credibility as a practitioner too.
Yeah. That's great. So we're going to finish up here. I'm going to put the links underneath this podcast for them. And how can they find more information?
Yeah, you can visit alleviatetherapy.com or you can email us at info@alleviatetherapy.com.
Great.
Thanks so much
guys.
for having us.
Thank you.